Welcome to the Ethnomed podcast, a community voice in the clinic. My name is Dr. Duncan Reed, a physician in the International Medicine Clinic at Harborview Medical Center and medical director of Ethnomed, a web resource for providers and patients with information for cross-cultural care. Today, we are continuing our interview series called Provider Pulse, where we elevate diverse voices from across healthcare fields to learn the paths people took to their current roles in healthcare, and how their cross-cultural experiences have helped them provide more informed care to diverse patient populations. Whether you are an undergraduate student considering a career in healthcare, a practicing health professional, or a member of the community, these conversations are for you.
I think Peace Corps is an interesting experience and how there aren't many other situations when you're willingly put in a community where you don't know anyone and you don't speak the language. And I don't want to compare it to the patients we're seeing in clinic because those are much more challenging situations. And I, of course, was there by choice and I could leave anytime if I needed to. But I do think that it's helped me understand what it's like to be in an unfamiliar country, even times when I was sick there and had to seek medical care early on and wasn't comfortable with the language. I think it's allowed me to empathize a little bit more with what it's like for patients in these really unfamiliar places. I think it's allowed me to connect with patients who are new to the country and are adjusting.
On today's episode, we are featuring a discussion with Dr. Chloe Donegan, an internal medicine resident at the University of Washington Medical Center. She discusses her experience as a Peace Corps volunteer and the insights this has provided for cross-cultural care.
My name is Chloe Donegan. I am a first-year resident here at the University of Washington Internal Medicine program. I'm originally from Oregon, and I have been mostly in the Southeast since then, in Atlanta, and then in South America as well. I'm originally from Corvallis, Oregon, which is where Oregon State University is. I was born there, and then I lived there for the first 18 years of my life.
Are either of your parents academics?
Sort of. They are both entomologists, and they met in school at OSU. My mom was originally working at the EPA, and then more recently was working at OSU in horticulture. She recently retired. Definitely a lot of biology and interest in natural sciences growing up. For undergrad, I went to Emory University in Atlanta, and I played soccer, so that was part of what brought me out there. I would say I always had a little bit of an interest in medicine, but I don't have any physicians in the family, so I didn't really know what the path to medicine looked like. Having parents who are both entomologists and interested in biology, I was always pretty interested in the sciences. When I was younger, I was more into math and was interested in becoming a math teacher. In high school, I was thinking more the biology route. So going into undergrad, I was thinking something in biology, potentially medicine, but I didn't really know what that path looked like.
So you did a biology undergrad degree?
Yes. After graduating, I went back to Oregon and was coaching high school boys soccer at my old high school. I was coaching the freshman team in the fall. And then at the beginning of the next year, I went to Paraguay, and I was there for a little over 2 years with the Peace Corps. In undergrad, I was exploring different career paths. And so I mentioned thinking biology and interested in medicine, but a little uncertain. I felt like I was deciding between public health, medicine, and research, and trying to explore all of them. I came upon Peace Corps and trying to explore public health a little bit. Some of that was being in Atlanta, which is a pretty global health-focused area. The CDC is right by Emory, and Rollins is the School of Public Health at Emory and has a lot of returned Peace Corps volunteers. And so I just went to a session in undergrad that a returned Peace Corps volunteer had put on. It seemed like a really wonderful opportunity to explore global health. Having grown up in Oregon and lived my whole life there, and then going to a different part of the country in a city that was different in a lot of ways from where I grew up, I had found that just being around people from different backgrounds was really valuable, and I think allowed me to empathize in different ways and learn a lot about myself and the world. I think the other thing is just the returned Peace Corps volunteers who I talked to all recommended it and said they had wonderful experiences. And I was generally interested in healthcare disparities. Atlanta and Georgia both are areas where there are very high levels of healthcare disparity. And so all those things came together and Peace Corps seemed like a good next step. So when you apply, there are different cycles that you apply to. And so you can apply for all the available spots during that cycle. And you can list your preferences. So both in terms of the sector you work in and then the location. And I had taken Spanish in high school and college and knew remedial Spanish, but by no means felt like I could hold a conversation and felt that it was important to learn it in the U.S. with so many people speaking it. So I was interested in going to a Spanish-speaking country, and then I was interested in health. And so I ranked the health sector first, and then I think I just said generally Latin America. It was a little funny because I ended up in Paraguay, where Spanish is one of the national languages, but Guarani is the other official language, and the area that I was in, people actually speak much more of that. So I did learn Spanish, but I spoke more Guarani where I was.
What was your takeaway from that whole experience, looking back on it now?
Yeah, not only is it sort of a job for 2 years, but it's your entire life for 27 months. And so I think it's hard when people ask, how was your experience, to sum it up in a few sentences. But I had a very positive experience, and I really enjoyed being in the community that I was in, felt like I formed some really special relationships there. And I actually was able to go back a few months ago. So it had been 5 years since I was there. And when I left, I told everyone I would go back for someone's 15th birthday. And so I was really happy that I was able to keep that promise. And so I went back. It was a pretty brief visit because it was right before medical school graduation, but I had a little time there. I was a little worried about if I would still feel as connected with the community because so much time had passed, and it's a little bit hard to stay in touch with people, and it's hard to keep up with Guarani here. And so I just was worried that I was going to have a hard time communicating with them, or that I would just feel really distant. But I was very pleasantly surprised that when I went back, it just felt like I was back to 5 years ago, just when I had been living there. And things had changed generally in the country, and especially COVID has changed things everywhere. But the community itself felt quite similar, and I still felt as connected with people. And so I thought that was really nice. I think the connections I formed with community members is, when I just kind of reflect on the whole experience, is what I feel like has been the most impactful part of it and what I think about when I reflect on it. I think Peace Corps is an interesting experience, and how there aren't many other situations when you're willingly put in a community where you don't know anyone and you don't speak the language. And I don't want to compare it to the patients we're seeing in clinic, because those are much more challenging situations. And I, of course, was there by choice, and I could leave anytime if I needed to. But I do think that it's helped me understand what it's like to be in an unfamiliar country, even times when I was sick there and had to seek medical care early on and wasn't comfortable with the language. I think it's allowed me to empathize a little bit more with what it's like for patients in these really unfamiliar places. I think it's allowed me to connect with patients who are new to the country and are adjusting.
Can you tell me briefly, I think you alluded to this, you were seeking medical care there. Would it be okay talking about that a little?
Yeah, some of that is just general medical care, but some of that is, it's fairly common for Peace Corps volunteers to get GI parasites. And so a number of times I got Giardia. And when you're already feeling really sick, and the community I was in is pretty rural, and so to get into the closest town is like a 2.5-hour bus ride that leaves once a day very early in the morning. And then if it rains, the bus doesn't run because it's a dirt road. To just get to the hospital is a trek. And then when you're sick and not feeling well, it's hard to do anything. This was pretty early on when I was new to the community and still learning both Spanish and Guarani, going to this hospital. And Peace Corps had actually called ahead of time that I had an appointment and I was supposed to have an interpreter with me. And when I got there, someone came up to me saying like, oh, I'm your interpreter. And then I don't really know what happened. But then when I went to see the physician, they were gone. The visit was in Spanish. And there were some things that were fine. And then there were some things that I just felt a little confused about and that things weren't really getting answered. And in general, accessing medical care is uncomfortable and scary for someone who's in the field, who's born here and fluent in English. I think it's challenging for me to do. And it's a very vulnerable situation. So I think adding all of those things on top of it made it quite challenging. Again, I don't think it's anywhere as difficult as what many of our patients are experiencing, but I think it gave me a window into what that experience could feel like.
It sounds like Peace Corps was a really positive experience for you. And then how did that line up in terms of medical school, just from a practical standpoint?
During undergrad, was interested in medical school. Junior year had a number of life challenges, a lot of things going on. And at that point thought, I definitely am not going to medical school because I don't think there's any way I could do that. And then by the time I was graduating, I was thinking probably medicine, but I still want to explore global health and just take some time to see what else is out there. So before I left for the Peace Corps, I took the MCAT a month before I left. So I was sort of prepared to apply to medical school if I still wanted to do that. And then I ended up applying during my last year of Peace Corps, which logistically was quite difficult. And this was pre-pandemic, so virtual interviews were not an option. I applied while I was there and then ended up coming back for 2.5 weeks to the US and just flying all around and doing all my interviews. I think just in terms of the decision, I think before I was looking at it as, okay, I could either do public health, medicine, or research. And then through further exploration, kind of realized, well, I could really do all of those things with the medicine route. I ended up doing an MD, MPH. I think being in this rural community that there were not physicians accessible, there were not nurses accessible, I felt like there were a lot of public health things that were helpful. It was reassuring that medicine is what I want to do and that I like to interact with patients directly. And even just sometimes in the community, I would have community members asking me medical questions, thinking that I was a provider just because they knew I was working in community health, and I did not feel equipped to answer them. I can remember one time a woman pulled out her scans and was showing me and like, oh yeah, what is this saying? And I was just like, I have no idea, but I wish that I could answer those questions. And so I think it helped me see how I could practice medicine without having to leave the interest in public health and community level health, and also seeing how I could still involve addressing healthcare disparities in my practice, because I think some of my hesitation with medicine is feeling like, oh, I'm just going to be like a cog in a machine, and I see patients, but I'm not able to make much impact because I'm just working in these flawed systems, and I want to be able to change things on a larger scale. It shifted my thinking to be that I could do both of those things. I also had a pretty impactful experience in the community. It was a really tragic incident. My host sister, I wasn't currently living with them, but it was a family who I had lived with for the first couple months in the community. She was 8 months pregnant and died very suddenly. I was actually not in the community when it happened, but it sounded like ambulance arrived, they were on the way to the hospital, and she died on the way. And I was nearby actually coming back into town, but I think the bus wasn't running or something, so I was having to stay a little bit out of town, and then got a call from a community member that this had happened, and so I ended up being able to get a ride in and then attend her wake was going on when I arrived. And it was one of the most intensely emotional experiences I've ever been a part of. And I think a lot of that is seeing how grieving is expressed differently in different cultures, and that it was like a very community-focused healing where it was very public that family members were suffering and sad, whereas I think oftentimes what I've seen more in the US is both are a lot more private with those kind of emotions. At the time, we didn't know the cause, and it sounded like sepsis. It sounded like she had maybe some kind of abdominal infection, and then it had spread. And that's what I had thought happened until when I recently was back and was talking with another host sister, and it turned out she had had preeclampsia and then I think just hadn't gotten medical care. And so to me, it was just like this incredibly tragic and concrete example of how lack of access to medical care leads to these really horrible disparities. And in this case, it was just this very rural community where there wasn't access to care, and it was probably an hour to get to the closest hospital. There were a few sort of incidents like that. That was a more poignant one. I saw very clearly how people didn't have access to care, and it very negatively affected them.
You're alluding to some of these challenges you had in undergrad.
Mm-hmm.
So many young adults do.
Yeah.
And I think so many people feel like that's the end of their dreams for these really challenging careers. So on the one hand, you said, this is the right path for me. But how did, on the other hand, did you gain the confidence to say, I can overcome whatever these hardships? Because I think this comes up with a lot of students that I talk to, whether it be an academic or a personal hardship. They feel a sense sometimes of despair and said, how can I possibly pursue this?
I think it's a very important question, and I wish I had a helpful, concrete answer. I think it's a problem faced by many people, but I think the solution is probably variable and really depends on the person and the situation. I think part of it for me was just these couple years in the Peace Corps. There was a lot of personal growth and personal reflection and just general maturing. And I think those things were helpful. One thing that I didn't experience a lot of in undergrad that I think would have been more helpful is just having mentors who were able to show that vulnerability and show, like, I'm here now either as a medical student or as a resident or as an attending, and maybe it seems easy for me now, but I also struggled at this point, wherever it is along the path. So I think being able to identify mentors is something that can be really helpful with that process. But then I think just acknowledging that, as you said, it's very common and a lot of us experience it and feel alone in it. But that's just not the case. It's a very common feeling and experience. And I don't think it's bad for people to explore other options in medicine. I think it's good. I think oftentimes people get the advice of medicine is so hard, you should do something else. And I think it's great to, especially if you have felt pressured to explore medicine because it's something that your parents want you to do or your family wants you to do, or you feel like you're doing because of societal expectations or something like that. I think it's important to explore other options, but I don't think that just because someone has had some kind of failure or something, it means that they're not going to be able to be successful in medicine.
I have this other question about your background, because it sounds like you're comfortable being outside of your element. Is there something about your personality or something that has led you down that way where you feel an incredibly open-minded person to be able to go through those things?
I think the two things that I could identify are, well, I'll say three things I could identify. First is that my mom has always been very focused on social justice, but actually between the time that she was at the EPA and then OSU, she worked for a community nonprofit that was focused on like various aspects of diversity in the Corvallis and supporting community members. Some of that was just role modeling for my mom. I think another part of that is that identifies queer. And so I think having an identity that's not the majority, I guess, in some ways that has helped me see the importance of understanding different backgrounds and being interested in uplifting marginalized groups. The other thing that it's a little bit hard to pinpoint exactly how it has impacted me, but I think has definitely affected my personality and how I view the world. My older sibling was adopted into our family when she was 4 years old, and it was right before I was born. She has had a pretty challenging time in the world, and her mother did as well, and her mother was in jail when she was born. My sister has borderline personality disorder and has really struggled with substance use and substance use disorder. And so I think growing up in that environment, she struggled in many ways. I think something about that relationship really allowed me to feel empathy towards people regardless of knowing their situation, and made me curious about people's different backgrounds and why they are the way they are, and just wanting to approach people with an open-mindedness and a sense of empathy and curiosity. Medical school was interesting. I would say the first part of medical school, preclinical, for me was the hardest because it just felt so removed from patients. I think clerkships are challenging in different ways, and that's when you're rotating. But because it was so much more fulfilling, and even if I was having really difficult days, I was getting to interact with people every day, it was enjoyable. But I think people have a lot of different opinions.
I think so much of your story so far will resonate with so many pre-meds. Maybe they hadn't thought about the Peace Corps. Maybe it didn't seem doable.
Yeah.
Maybe it didn't seem compatible with this medical application process.
Right.
And then talking to you, you're like, well, it actually worked. And actually, if anything, sounded like it bolstered your thinking about going into medicine.
Yeah. Yeah.
How long have you been in residency for?
Less than a month. Yeah.
How is it going so far?
It's good. I think it's an adjustment, just being in a new city, having moved across the country. There are just a lot of adjustments going on at once, which is challenging. And I think there's anxiety about what is to come, but things are okay right now. And I'm enjoying making new friends with co-interns and starting to build my community here. And the clinic, the international clinic, has been amazing. It feels like a little family there. So I'm excited to, over the next 3 years, have that as a home base.
And what does your future look like?
That's a great question. I am still figuring that out. I'm interested in trans and gender diverse healthcare, both as a provider, but also in terms of policy and advocacy. And then I'm also interested in working with immigrants and refugees, specifically Latinx populations, since I speak Spanish. So I'm unsure exactly what things will look like. I think ideally, I would like to stay in academia and have some balance of working as a hospitalist and being on teaching teams, and then having a clinic that is either focused on gender affirming care or something like the international clinic where I'm working with a specific population that I'm passionate about. I would like to have some kind of balance between inpatient, outpatient, and would love to be able to work with residents and med students.
We hope this episode has offered insights that help listeners better understand cross-cultural perspectives. In today's conversation, Dr. Chloe Donegan reflects on how her Peace Corps service in Paraguay, her personal identity, and her lived experiences have shaped her commitment to caring for marginalized communities. We will be continuing our Provider Pulse series with more interviews featuring healthcare professionals whose life journeys have deepened their ability to deliver effective, culturally responsive care. Here's a preview from our next guest, Ranak Banam.
I always wanted to be a doctor, and more specifically an OBGYN. My mom, she passed away when I was 8 years old. So that's where it was all planted in me. Nobody around me was a doctor. When I got into my undergrad, that's when everything hit and everything changed. I just felt like I wasn't prepared. I was always thinking medicine, but I just felt like it's so out of reach. I felt like I wasn't ready. I was struggling a lot in my sciences. I was struggling a lot. Just issues of exam anxiety, presentation anxiety, all of that.
Be sure to visit our website at ethnomed.org for additional resources. Also follow us on YouTube and Instagram at ethnomedUW and on LinkedIn. Thank you.